Hey guys, David here, and I just want to show you a really quick animation, and we're going to look at the knee joint here, and this is of course the left thigh. Now, when we look at making these, we look at training the lower body, and let's get this kick up here. So when we look at movement through the lower limb here, and this is of course the left thigh flexing. Part of the problems that we encounter is that what we're trying to create is balance and symmetry in muscular behavior, and here's one of the reasons why. So this is the quadricep. The quadricep, of course, means four heads. So you got four muscles, and all four muscles share a common tendon at the knee joint here, which is the patella tendon. And if the balance between these muscles is irregular, meaning that we're generally weaker on the inner part of the thigh, the vastus medialis tends to be quite a bit weaker, and the mid to lateral part of the thigh tends to be tighter and stronger, not to mention having something like called an IT band, which can be very tight and problematic. We can really create a bunch of lateral stress, and really taking this kneecap, it should be tracking fairly beautifully in a fairly nice, beautiful tracking position, nice neutral position, and the kneecap starts tracking a little bit more laterally, right? So you see this beautiful groove here, where the kneecap slides along. Well, the kneecap has a set of grooves that it should be sliding on if and only if the tension and the strength and timing of the muscles in around the knee joint are accurate. If we're inaccurate, of course, what will happen is that this muscle may not be firing adequately, and as we go to flex, the kneecap's going to be pulled to the outside, and it's going to end up creating friction, irritation, and then inflammation, which of course changes the whole function of the knee. So when we look at training in the beginning, it's not just about can I go for a run without strengthening my thighs. We want to make sure that we're teaching the nervous system to recruit muscles in a very specific pattern. So we actually have this beautiful stabilization action occurring at the knee joint, and having all these muscles in sync and being very harmonious in the way they contract. And of course, that's them from a neurological level, getting the brain to actually start focusing on changing these recruitment patterns. One of the ways we can do this is, of course, when we're bridging, we can kind of focus on squeezing a ball between our thighs as we bridge, which of course will help activate the vastus medialis. And sometimes, of course, we can palpate, which means just take 2 or 3 fingers and you tap this part of the thigh. You tap it with your fingers, for 30 seconds or so, and what it'll help do is facilitate it. Actually makes the nervous system very heightened in that area. We call it kinesthetic tactile stimulation. And we stimulate the muscle to become more active. And then we go in and try the activity. Let's say we're doing a squat, or we're doing a reverse lunge, or we're doing a bridge. So we can actually encourage that contraction to occur by actually stimulating, by tapping in on it. And of course, we can also hold foam blocks or a small volleyball size ball in between our thighs as we're squatting, as we're doing our bridging, to really help to inspire this muscle to contract a little bit more aggressively. So again, we live in a beautiful machine. It's an incredible work of art, but it does take a little bit of talent, a little bit of attention to make sure that you get through all the workouts effectively and safely. And sometimes it helps to know what's going on under the skin.